Well, it's likely that you or someone you know has been sick over the past month with several respiratory illnesses circling right now. So how can you protect yourself and your family and know what illness you're even battling?
We have Dr. Dora Anne Mills from MaineHealth here to tell us much more. Good morning. Thanks for being here.
Good morning, Katie and Jeff. It's good to be here. Thank you for having me.
Of course. So new CDC reports show the state is seeing cases of COVID, the flu, RSV, and whooping cough all at once. Kind of a quad-demic? I mean,
sort of, it's, I kind of compare it to the weather. For those of us who are old enough, remember 40 or 50 years ago, you didn't really know what was going on with the weather reports are like a day or so out. Because we just didn't have that great of weather forecasting. But now with people like Christian and others, we have a lot better in the technologies. So it's the same thing with respiratory viral seasons. We know a lot more because a lot of these viruses are now reported. We're testing for them. So we know a lot more about what's out there. So we probably had pandemics all the time years ago, but we just didn't know exactly what viruses were circulating. Now we're testing for them. We know a lot more. And yes, this seems to be about our peak respiratory viral winter season right now, and along with the cold weather. So, but this season isn't setting records, but it also is the usual bad peak that we have with influenza, now COVID. We didn't used to have that prior to 5 years ago. RSV, and like you said, whooping cough. So we're seeing a lot of that in Maine as well as around the country.
The one thing I know I've maybe been seeing out there or hearing so many friends, I mean, I have kids, so I hear from schools and everything. It seems like people are sick longer. Is that the case, or just people are staying out? They used to, maybe come back when they shouldn't have been.
Yeah, I think it's both of those. So the summer virus is often, you don't get sick as long. You get a mild cold and it's done and over with. The winter viruses often do take longer. So RSV, for instance, and influenza and COVID, you can be sick for, have the symptoms for a week or two. So, and people are much more aware of the fact that if you are having symptoms, please stay home, stay away from others who may be at higher risk for getting severe disease, because yours may not be severe, but others may be at risk for getting much more severe disease, and or wear a mask when you're around other people. This is the time, I know we don't like to talk about masks, but this is the time if you are having a lot of symptoms and you're around people who may be higher risk particularly, please wear a mask. Or if you're at high risk and you are around a lot of other people indoors, then consider wearing a mask.
So the CDC says that there have been about 100 flu-related hospitalizations this season. Does that number concern you? How does that compare to maybe previous, seasons?
That's kind of a run-of-the-mill season, to be honest with you. I've been following influenza in Maine for almost 30 years, and that's kind of the run-of-the-mill. We are hearing reports of a lot of outpatient settings being very crowded with people. So emergent care, emergency rooms, and primary care offices are really, the phones are ringing off the hooks and people are coming in. So please do seek care if you need to. We are open for that, certainly, but bring a dose of patience too. So, and also wear a mask when you have symptoms you're going to be seen for around. The other thing is washing your hands very frequently. That is important because that's a big way where we contract these viruses is we shake hands and then we, with somebody who might be coming down with it or recovering who has a virus on their hands, and then we touch our eyes or our mouth or our nose, and that's how it gets into, the viruses get into our body is through the membranes of our nose and mouth and eyes. So washing your hands and getting those shots, the COVID vaccine, the flu vaccine, RSV if you're eligible for it, is not too late, and it's particularly important to get the influenza vaccine because of H5N1 circulating amongst cows and poultry. We don't want to have that virus get in contact with the seasonal flu and influenza virus because they could merge and create a hybrid, a much worse virus, such as we had with H1N1 back in 2009. So that was a swine flu, a pig virus with a human influenza virus. So same thing, we don't want these viruses. We don't want these viruses to connect with each other. So if you're vaccinated against influenza virus, you're much less likely to get it or have a much milder case, not have as much virus, and therefore it reduces the chances of the H5N1 merging with a seasonal influenza virus. That was a long answer.
That was a
no,
long answer.
You nailed it, but
Yeah.
that's a lot of numbers and letters.
I know
So
exactly.
you just want to get the two. So this
Right.
is a particularly important year to go out and get that flu virus vaccine. So
Have we come to the point where COVID, you should test for it, but is it just now just a bad cold, or
for a
what?
lot of people, it is a bad bad cold. But for many, it's not. It's particularly people who are at high risk, anybody over 60, 65, anybody very young, or people with chronic diseases. And we're the oldest state in the country. So we have a lot of people who are high risk for more severe disease. But for some people, they tend to get a bad cold. I know people who are very healthy and young and still get a very severe illness. It just seems to be, we don't know who's going to get more severe disease. But yeah, COVID is around, and certainly that's one reason why maybe our outpatient settings are very busy, because people want to get tested and get Paxlovid or whatever medication that they may be eligible for to get. Because you can, early on in the illness, you can get medications that help reduce the severity of the illness and the length of it. Same thing with influenza. Tamiflu is the main medication that's used there. So if you think you have influenza or COVID, you can get tested and call your provider, your PCP, get tested, and you can get one of these medications that'll help reduce the number of days you're sick. You know?
At what point should we be going to the hospital or even going to the doctor? You know, it could be a common cold. It could be they might not be able to do anything for you, but there are also severe cases.
Yeah, so if you're sick with a fever, and especially if you have the symptoms of COVID or influenza, which is generally a fever, oftentimes starts with a sore throat, and really feeling a lot of body ache, and especially if you're at high risk for severe disease, then make sure to call your PCP earlier than later, because the earlier you get on one of these medications for either influenza or COVID, the more likely they are to be beneficial to you.
All right, we're in the technology age, so where's a website that people can go to learn more about, like some of the stuff you already talked about?
Yeah, well, certainly MaineHealth.org, we have a lot of information there, and then also the Maine CDC, just put in Google Maine CDC or US CDC, and there's plenty of information there on respiratory viruses and what you can do to be safe. Washing your hands, getting vaccinated, if you're high risk or you've got symptoms, you have to be out with other people, wear a mask, and that's pretty much it.
Dr. Mills, thank you so much. We hope that you stay healthy in 2025.
Thank you, and you too. It's great to see you both.
Sounds good. Thanks for coming on. Appreciate it.
Sure.
All right, as we head